So I'm here to talk about the pilot that we conducted last year and this year. There's phase 1 and phase 2, but also about the new maternal sepsis definition as well. This is the new maternal sepsis definition. It was developed by collaborative with WHO just last year, and we've certainly taken it on board as well. I think it's really important that we have a maternal sepsis definition, not just from the adult patient point of view, because the pregnant lady goes through lots of different changes because of her pregnancy, immunological and physiological and mechanical changes. And not only that, the changes, what we call the minor disorders of pregnancy, that can actually mask some of the signs and symptoms of sepsis as well. So it's really, really important that we have this definition particular to sepsis. And it's quite similar to the inpatient and the adult non-pregnant person, but it's a maternal sepsis, life-threatening condition defined as organ dysfunction from an infection during pregnancy, childbirth, post-abortion and postpartum. Pregnant lady is from, say, day of conception to 42 days after giving birth, and still under the influence, or her body is still under the influence of the pregnancy changes all through that time. How common is sepsis in pregnancy? It's not as common, but it still occurs. In fact, it's the third leading cause of direct maternal deaths globally. Between Ireland and the UK, it's actually the fifth leading cause, direct leading cause. In 2015, there were just under 66,000 pregnancies in Ireland. 8,336 women were admitted with infection or diagnosed with infection as an inpatient. So that's 12 in 100 pregnancies. And as I said, that's pretty low, but it still occurs. And there was 308 sepsis diagnoses, so that's 1 in 214. Thankfully, last year, there were no maternal deaths. The whole catalyst for this program, by the way, came from a maternity case, which I'm sure you're all familiar with. So the aim from the maternity sepsis program was to give every woman the best opportunity to survive. And we considered the balancing measures, so avoiding overdiagnosis in the first instance. And if the woman has signs and symptoms, that's not of sepsis, that we define why that is. And of course, we're following best evidence guidelines. The definition came from best evidence guidelines by a collaborative with WHO. Early recognition, it's the exact same for the non-pregnant patient. So really important that we're getting in there quickly, that we're recognizing the signs and symptoms of infection, recognizing organ dysfunction, and that we're giving the appropriate treatment in a timely fashion. So we had 2 pilots. The first pilot was through last year, so we invited all 19 maternity units to partake in the pilot. 12 maternity units gave us feedback. In fact, all of the maternity units gave us some form of feedback. The 12 maternity units completed the feedback forms for us. Our first pilot was over a 3-month period, and then we asked the units to fill in the feedback forms. The feedback forms were then analysed by a multidisciplinary committee, so between the National Sepsis Programme and the Obs and Gynae national programme. So there was anaesthetists, midwives, obstetricians and microbiologists on this collaborative. So we made lots of changes to the form, and those changes have actually informed the current form that we have, and I've got a slide on that. Really, really important that we were getting feedback from the end users. We needed to know that it was user-friendly, and that it was user-friendly within a timely fashion as well. So that was really important. So for anybody who partook in either of the pilots that are here today, thank you very much. It was hugely important for the work that we're doing. After the changes were made, we conducted a smaller, less extensive pilot with 3 hospitals. And again, there was lots of feedback from the midwives and obstetricians. Like you can see the numbers there yourselves. So just the next few slides actually show us the usability of the form and the feedback. Both of these slides, the same question rather was asked, the overall layout of the pathway. So the pathway, I'm not sure if you're all familiar with it, but the pathway is the front page. The back page is treatment, so the front page is screening. We asked if the overall layout of the pathway followed a logical sequence. And you can see there that there was more agreement than non-agreement, just to bring your attention to the colours, if you like. The dark green is strong agreement, the light green is agreement, the orange is neutral, and the pink is disagreement, and then the red is strong disagreement. So you can see there that it's predominantly green. This was the risk factor section is helpful with identifying women at risk. This was asked in phase 1, and again you'll see there that the pie is predominantly green, so agreement again. There is a section here, the risk factors, that details the risk factors from a pregnancy point of view and from a non-pregnant point of view. Concerns a woman could have sepsis section is helpful with identifying women with suspicion of infection or sepsis. And that details a lot of signs and symptoms that, as I said, we consider minor disorders of pregnancy. So it was really important that we were putting that out there. Please consider infection, that it may or may not be down to the pregnancy causing those changes. And again, there was strong agreement with that people found that very useful. So is the pathway required? So that again is the pathway, the front page. And you can see there, like almost 80% said that yes, the pathway is required. So of course we left it in for the form that we have now. This is the form that we have now. I don't have a copy of the older form that we piloted in the first instance. These are then from phase 2 of the pilot. Is it easier to decide who needs to get the sepsis 6? So there you can see predominantly, again, there's green. There is percentage neutral as well, but predominantly green. Does the sepsis form prompt the required clinical blood test to recognize sepsis? Again, predominantly green. Does the form prompt the required clinical and bio assessments to diagnose sepsis and septic shock? Again, predominantly green. And to treat sepsis, so again, predominantly green. So this was really, really important because these were the people that are using the form, so we know it is user-friendly. Because there was a lot of feedback that talked about ISBAR being used within the maternity sector, and we incorporated ISBAR into the entire form rather than just having a piece of or for communication. And you can see that actually that's way clearer. You can see that, are you concerned that a woman could have infection? Yes, there's a lot there that you're thinking, oh gosh, well, a pregnant lady could have back pain, a pregnant lady could have pelvic pain. But it's really thinking about, well, is there something else happening, and looking at the overall picture. And you've heard from Sarah and Eve this morning the importance of actually listening to our patients, and not just listening to our patients, but listening to the family of our patients as well. And the risk factors are there too, the pregnancy related and the non-pregnancy related. And then the section down at the end there, it's incorporated, it incorporates the IMUs, which is pretty much embedded in maternity practice now. So this is just the first part there, is for the midwife, so the screening. So asking the midwife if there's signs and symptoms of infection, plus any of the following, so 1, 2, or 3. One is more than 2 yellow or more than or equal to 2 pinks. And of course the modified SIRS criteria, just slightly modified from the inpatient non-pregnant person. And it needs to be sustained as well. That's really important. And pregnant ladies can be at risk of neutropenia too. So it was really important that that was on there as screening as well. So who needs to get the sepsis 6? And quite similar to, I don't know if you've noticed this placard here. This is the inpatient non-pregnant person, so it's quite similar to that. I think it was important to have uniformity in all the charts, but obviously being cognizant of the patients in our care as well. So who needs to get sepsis 6? Infection plus either the sustained SIRS response or if there is clinical or biochemical apparent onset organ dysfunction, or patients who present unwell or who are on treatment that puts them at risk of neutropenia. And that's just for an example, like anti-cancer treatment. They might be on other immunosuppressive drugs as well. So this was really important too, and we put this in on the basis of feedback as well. And Anna and Paul talked about that too, the importance of actually defining the handover, that the handover did actually happen, and the doctor being able to sign that this is where I handed over, that I haven't been in a position to check the investigation, so they need to be checked. So I think that's really, really important as well, and physicians quite like that part of the form. So our plan for 2017 to 2018 is the rollout of the maternal sepsis forms to all the units. Yes, we know that Cerner is pending, so any of the units that have Cerner already, sepsis is already in the Cerner program. So once Cerner is in each maternity unit, the form will be not required then at that point. We're also planning on doing a maternal sepsis e-learning program similar to the non-pregnant e-learning program that we have. And I think, and we've talked about this all day, it's going to be really, really important to ascertain the sensitivity and the specificity of the form. So further analysis and audit is going to be required for that. And of course the form needs to be data driven, like as Vida said, it's a live document, so we can change it, not on a, well, whenever we need to, I won't say regular basis. I think we need to get used to using what we have in the first instance. And this is our poster that's over there. We've got, this is part of the leaflet for our service users. So we are working on a booklet as well, but this is what we have for the moment. Those leaflets around this morning that has similar information on it. And we're asking pregnant ladies to be cognizant of all these changes here and to actually, that, I don't know, bubble, if you like, that's our checklist. So it's going to be important that people become aware of that and actually present to the GP or the antenatal clinics or even labour and say, I have X, Y, and Z. I think I have an infection, or we should be picking up an infection, but for them to be able to say, I think this is sepsis. So it gets us all on the same page and using the same language. Any questions? I flew through that, but I'm sure, oh, Vida, you can answer your own question.
Cerner had an inbuilt sepsis.
Oh, Performa.
Is it the
It's
same?
similar. We actually met with, or a couple of us met with Cerner just recently, or the guys developing Cerner, and put in the pickup piece, the recognition piece, and the diagnostic piece. But there are a few Dropbox that pick up the CERS component. You might like to expand on that yourself a little bit more. No?
Yeah, we use the pilots to inform and update our sepsis proforma in Cerner. So we've met subsequent to the pilots with the Cerner developments to ensure that all of the suggestions from the end user get incorporated in the maternal electronic patient record system.
No more questions? That's it. Thank you very much. That's a question over here.
Thank you very much. I just wanted to ask something about Cerner. Is there any triggers in Cerner in a way that if, for example, a box for sepsis is clicked, then it triggers that the form should be filled?
Yeah, so as vital signs are inputted into the Cerner electronic patient record system, if the patient has CERS criteria, a CERS alert goes out, and at the same time the system interrogates the laboratory results in the previous 24 hours, and if there's evidence of organ dysfunction in those blood tests, it sends out a sepsis alert, a potential sepsis alert. And it recommends that the patient have medical review to see if they do in fact have sepsis.
Thank you very much. That's really great.